Regenerative medicine is rapidly evolving, offering hope for patients with blood disorders and cancers. Traditionally, treatments like chemotherapy and radiation target tumor cells, but also damage healthy blood-forming cells in the bone marrow. This often leads to myelosuppression, a condition where the bone marrow's ability to produce blood cells is severely compromised. As a result, patients may require hematopoietic stem cell transplantation to restore their blood cell production. However, the recovery of the bone marrow niche, the supportive environment for stem cells, remains a major challenge. Today, we explore how niche-targeted therapies are changing this landscape, providing new strategies for healing and regeneration. Bone marrow is a vital organ responsible for producing nearly all types of blood cells. At its core are hematopoietic stem cells, or HSCs, which can develop into various blood cell lineages. The bone marrow niche is a complex microenvironment, consisting of supporting cells like endothelial cells and mesenchymal stromal cells. These cells play a crucial role in maintaining HSC activity and ensuring healthy blood cell production. When this niche is damaged, either by disease or aggressive treatments, the entire process of blood regeneration is disrupted. Understanding the bone marrow's structure and function is essential for developing effective therapies. After chemotherapy or radiation, not only are tumor cells destroyed, but the bone marrow's supportive niche is also damaged. This leads to poor recovery of hematopoietic stem cells and reduces the effectiveness of subsequent treatments, including stem cell transplantation. The mechanisms behind bone marrow niche recovery are not fully understood, and current therapies often fail to address this critical aspect. As a result, patients may experience prolonged periods of low blood cell counts, increasing their risk of infection and other complications. Addressing these challenges requires a new therapeutic approach that targets the niche itself. A team of researchers from the University of Tokyo and collaborators in the USA and Japan have pioneered a fresh approach, niche-targeted therapies. Instead of focusing solely on hematopoietic cells, these therapies aim to restore and enhance the bone marrow microenvironment. By targeting the niche, they hope to improve the recovery of blood cell production after injury or treatment. This innovative strategy represents a shift in regenerative medicine, emphasizing the importance of the tissue microenvironment in healing. Let's dive deeper into how these therapies work and their potential impact. Central to this new approach are two transcriptional coactivators, YAP and TAZ. These proteins regulate gene expression within the bone marrow niche, particularly in mesenchymal stromal cells and endothelial cells. Researchers created mouse models with YAP-TAZ genes knocked out in specific cell types to study their effects. They found that YAP-TAZ activity in mesenchymal stromal cells is essential for retaining hematopoietic stem cells in the bone marrow. Without these proteins, stem cells are lost to circulation and blood cell regeneration is impaired. YAP-TAZ in endothelial cells also plays a critical role, especially after injury. Through a series of experiments, researchers observed that mice lacking YAP-TAZ in mesenchymal stromal cells had fewer hematopoietic stem cells in their bone marrow and more circulating in the blood. This demonstrated the importance of basal YAP-TAZ activity for stem cell retention. When exposed to radiation, mice with YAP-TAZ knockout in mesenchymal stromal cells showed impaired hematopoietic recovery, while those with knockout in endothelial cells experienced blood vessel dilation. These findings highlight the coordinated role of YAP-TAZ in both cell types for bone marrow niche recovery after injury. YAP-TAZ proteins regulate key transcription factors such as EB1 and EB3 in mesenchymal stromal cells. This preserves their identity and promotes the expression of hematopoietic and angiogenic factors like CXCL12. These factors are essential for supporting stem cell activity and blood vessel remodeling after injury. The coordinated action of YAP-TAZ in mesenchymal stromal cells and endothelial cells enables the bone marrow niche to recover and regenerate blood cells efficiently. Understanding these mechanisms opens the door to targeted therapies that enhance niche function. Following bone marrow injury, YAP-TAZ in mesenchymal stromal cells and endothelial cells work together to remodel sinusoidal vessels. These vessels are crucial for transporting blood cells and nutrients throughout the bone marrow. The remodeling process ensures that the niche can support hematopoietic regeneration, allowing for the coordinated restoration of multiple blood cell lineages. This aspect of niche-targeted therapy is particularly important for patients undergoing myeloablative treatments, as it accelerates recovery and reduces complications. Researchers identified a small molecule called GA003, which inhibits LATS1-2 kinase and increases YAP-TAZ activity. When administered to mice after radiation, GA003 significantly enhanced bone marrow niche recovery and accelerated hematopoietic regeneration. This molecule also promoted engraftment following stem cell transplantation and works synergistically with granulocyte colony-stimulating factor, a drug used to treat neutropenia. The discovery of GA003 represents a promising step toward pharmacological activation of the niche for improved patient outcomes. Targeting the bone marrow niche rather than hematopoietic cells alone, niche-targeted therapies like GA003 introduce a new therapeutic concept. This approach enhances the recovery of the microenvironment, enabling coordinated restoration of neutrophils, red blood cells, and platelets. It has the potential to improve the management of hematopoietic complications associated with chemotherapy, radiotherapy, and stem cell transplantation. The impact of this strategy extends beyond blood disorders, offering a foundation for future drug development in regenerative medicine. Identification of pharmacological YAP-TAZ activation as a viable strategy provides a foundation for expanding research into niche-targeted therapies across regenerative medicine and disease contexts. This conceptual framework emphasizes the role of the tissue microenvironment in regeneration, potentially influencing a broad range of research fields. By focusing on the niche, scientists can develop therapies that promote healing in various tissues, not just the bone marrow. This opens exciting possibilities for treating other conditions where tissue regeneration is needed. Targeted therapies have the potential to transform clinical practice. By enhancing the recovery of the bone marrow niche, these therapies enable faster and more complete restoration of blood cell lineages. This is particularly important for patients undergoing chemotherapy, radiotherapy, or stem cell transplantation, who often face prolonged periods of low blood counts. Improved niche recovery reduces the risk of infection, anemia, and bleeding, leading to better overall outcome. As research progresses, these therapies may become standard care for a variety of hematopoietic complications. Recent advances in regenerative medicine include gene therapies, engineered scaffolds, and spatial transcriptomic mapping. These innovations complement niche-targeted therapies by providing new tools for tissue regeneration and repair. For example, gene therapy can deliver missing genes directly to affected tissues, while engineered scaffolds restore growth in damaged organs. Spatial transcriptomic maps reveal how cells communicate within tissues, offering insights into microenvironment-driven regeneration. Together, these approaches are shaping the future of medicine. Future of regenerative medicine lies in understanding and manipulating the tissue microenvironment. Niche-targeted therapies are just the beginning, offering a blueprint for developing drugs that enhance regeneration in various organs. Ongoing research will explore new molecules, signaling pathways, and cellular interactions that drive healing. As scientists uncover the secrets of the niche, patients can look forward to safer, more effective treatments for a wide range of conditions. The journey toward personalized, microenvironment-driven medicine is underway. In summary, niche-targeted therapies represent a fresh and promising approach to regenerative medicine. By focusing on the bone marrow microenvironment, researchers have developed strategies that enhance blood cell recovery and improve patient outcomes. The discovery of molecules like GA003 and the understanding of YAP-TAZ signaling pave the way for future innovations. As this field grows, it will influence not only hematopoietic disorders but also broader areas of tissue regeneration and healing. The era of microenvironment-driven medicine is here, offering hope for patients and new directions for science.